Hello and welcome to Healthy Knees for You. I'm Robin Robertson with Healthy Knees Coach, and today I'm honored to have Dr. Michael Thorpe for an interview to talk about total knee replacement and knowing when the time is right to do so. This is part 2 of my conversation with Dr. Thorpe, and today we will cover point number 4, how many revisions are possible, point number 5, how long does a total knee replacement last? And point number 6, the youngest and the oldest total knee replacement patients that Dr. Thorpe had worked on. Stay tuned.
Advise them in all the non-operative care, and they're still suffering. So it's time to go ahead and bite the bullet and do it, because you're weighing, this pain, and you're not having the quality of life versus, yes, I probably will need a revision. And sometimes you can have a second revision or a third even, but the success rate just kind of tends to drop with each one because of scarring. The person's older, the bone quality isn't as good as the first time, and so forth. So the goal is 1, if we can get you there.
And so what's the expectation for how long replacement will last?
Yeah, it's getting better, with all the technology and the things we've learned through the last 20, 30 years. But I like to quote that about a 90% of the knees we put in today will still be going 20 years from now. That doesn't mean they're going to last 20 years and they all stop. It means 90% are still working at 20 years. And, then it'll maybe at 30 years, it's hard to get 30-year follow-up on people because most people are having their knees replaced in their 70s.
Right.
So you're not going to have much of a 30-year follow-up, but they're lasting a long time, so it's good. Yeah.
Well, I was 56 when I had my first knee replaced, 58 on the second, and I figured if it lasts 22 years, then I would be 56, that's 78 for my next replacement. And then if it lasted 22 years more, then I'd be 100, and then I'm dead. So that's all. Yeah,
you have longevity in your family. I know from your mother. And
that's
so,
right. Yeah. My side of the family tends to live to be about 100, so that's what I'm bucking for.
I don't have to worry about that.
In your surgical history, how young was the youngest person that you ever did a total knee on, and how old was the oldest?
Well, the youngest is easy to remember. It was a child at Children's when I was a resident. Back in the days of severe rheumatoid arthritis. These days, we won't be having that problem because of the drugs they call DMARDs, disease-modifying rheumatoid arthritis drugs. And but this young boy, we replaced both his knees, both his hips, and he was 13, 14 years old. That's really unusual.
Wow.
So once I was in private practice up here in Bellingham, I think I did have to do somebody that was either 29 or 30, a couple.
Yeah.
Post-traumatic arthritis where they fractured their upper tibia. It was just trash. There was nothing else I could do. And I said, well, do you want a knee fusion? No. Who wants that? You can't sit in a car well. You can't ride a bike. You can't do a lot of things. And so knee fusion's kind of gone away. And back the old Chester on Gunsmoke guy, walks. I'm dating myself, but they walk around with a stiff leg. Yeah. Nobody wants that. So, it is what it is. But as far as the oldest person, mid 80s, I'd say. Mid to upper 80s. I know of people who've had them. I did a total hip on a 93-year-old.
Okay.
And, I got Christmas cards from her. She came down from Canada for about 3 or 4 more years, and then all of a sudden I didn't. So I assume that she got 3 or 4 years out of it.
Well, but that's a good thing. It's about quality of life, because when, getting back to that question of when do you know it's time, and for myself, it was the number of activities that I could do got smaller and smaller and smaller until I was down to the basic. I could ride a bike and I could lift weights. And when my bike riding started to go away because of knee pain, then that was time for me.
Yeah.
I just couldn't.
And everybody will have that. What do they lose? What did they lose?
Yes.
That says, I don't want to continue like this.
Yeah, and oftentimes it's stairs, being able to walk up and down stairs. Now, strength training can help quite a bit with relieving some pain as you are experiencing knee pain. So being bone on bone doesn't necessarily mean the next step is surgery. It means be aware of what your joint condition is and do all the other things that you can do in order to get stronger and support your knee better.
Right. Yeah. Just know that knee replacement's an option, and have your have your legs be as strong as possible. And the other thing is the weight. Having your weight as low as possible. One thing I would quote my patients is that the stress between your kneecap and your femur is 4 times your body weight when you're climbing stairs or squatting. So if you weigh 200, there's 800 pounds going on in there when you climb stairs, and so every pound you lose, you take 4 pounds out of your knee joint.
Now, I didn't know that statistic. That's amazing. Yeah, so if you're carrying an extra 50 pounds, that's an extra 200 pounds of pressure, right?
Yeah, in between your kneecap
Between the kneecap and the femur.
Which, if you're already arthritic there, that's a lot.
Yeah.
Yeah.
So when you're doing a knee replacement, the